it was horrifying. I've never in my life felt like I was going to die until that day.
This mother of 8 from Lake Butler, Florida, is opening up about how close she came to dying from COVID-19. Janine Starling had chosen not to get the vaccine. Her husband wasn't vaccinated either, or their children.
What was it about the vaccine that concerned you, that made you not want to get it?
Just that it had not been around long. And honestly, I think I listened. I think I let people influence me, like saying, oh, you know, that this is the government just trying to fill our bodies with stuff, and they're trying to push this shot on us.
But earlier this month, Janine's husband got COVID. Then it spread to Janine and their 4 kids living at home, including their youngest, who is just 6. Soon, Janine was struggling to breathe, so they rushed her to the hospital.
I remember being very desperate, grabbing the mask and then feeling, the oxygen come in.
Janine spent 9 days in the hospital, 6 of them in the ICU.
In those moments when you can't breathe like that, even with all the oxygen they were giving me, it feels like you have a Ziploc bag over your head and somebody's holding it. And I had oxygen on, I was still feeling that way.
At 43, did you ever think that you would get that sick from COVID?
100%. I had had conversations with my husband and said, we've probably already had it. Just didn't even know it. And honestly, he agreed that we had probably already had it. And there have been times I'd been sick and I was like, oh, it's probably COVID. No big deal.
No big deal? Not exactly. Janine's oxygen had dropped to dangerously low levels, just 68%. She says she was told she had about a 20% chance of survival.
My youngest baby is 6 years old. And so when you're told that and you have a 6-year-old, he's probably, if I die, he's not going to remember me.
Janine is speaking out now because she wants people to know how much she regrets not getting the vaccine, a decision that nearly cost her her life.
I was one of those people that was like, I can't believe people are just going to just inject their body with this medication. We don't know enough about it. Now I'm just like, it is just a shot. Just get the stupid shot. That vaccine could have stopped all of this. Just one little shot. And I feel foolish that I didn't get it. I wish to God I would have got it. It's not just about what it could have prevented me from experiencing physically in my life right now, but it could have saved my family so much heartache. My children from seeing me go through that, my husband, and my siblings from seeing it.
So you're full of regret.
So much regret.
Randy joins us now from Jacksonville, Florida. Is she planning to get the vaccine now, and what about the rest of her family?
Yeah, Anderson, Janine is planning to get the vaccine as soon as she's strong enough to do so. She's also planning to get her whole family vaccinated, including her 6-year-old boy who's already had COVID, but she wants to make sure that he's vaccinated as well. In fact, Anderson, she thinks that vaccines for some professions should be mandatory, for teachers included. She plans to homeschool her children. She doesn't want anybody near her children now that is not vaccinated. And she's still, even though she's home from the hospital, Anderson, she's still dealing with a lot of pain and discomfort. You saw she's on an oxygen machine, so she's attached to that. She's having trouble breathing still. She can't even walk to the bathroom or walk to the mailbox without help. Her daughter, her 19-year-old daughter, is bathing her. So certainly not out of the woods, Anderson, even though she was lucky enough to survive it.
Yeah, and obviously no word yet on when children under the age of 12 may be able to get vaccinated. Randy Kay, appreciate it. Thank you. We're joined by 2 people who've guided us for the past year and a half. CNN's chief medical correspondent, Dr. Sanjay Gupta. He's in Tokyo, where COVID has certainly shaken up the Olympic Games. Also, Dr. Lena Wen, CNN medical analyst and former health commissioner for the city of Baltimore. Sanjay, as you wrote just last week, we got very close, tantalizingly close in the race against COVID. Now, as I mentioned, we find ourselves in this unsettling, confusing time. From a medical perspective, where are we in the course of the pandemic now?
Well, if the country came in for a checkup right now, Anderson, I think the doctors and nurses would tell them that they are concerned. I mean, you got about a third of the country now that has high levels of viral transmission. We're in July. This is supposed to be the best time of the year as far as viral transmission being low. People are primarily outside. The virus doesn't like to be outside. So this could be as good as it gets, at least for a period of time. And yet a third of the country, you can take a look at the map, viral transmission is high. At the same time that the viral transmission is high, vaccination rates are low. I mean, they're really remarkably low. I just got to tell you, I'm here in Tokyo. We've been talking a lot about athletes around the world. And there's people who are begging for these vaccines in countries where they only have 1% of the country vaccinated. And, you know, we can't give them away, apparently, in the United States. So those two things in particular, I think, you know, raise the level of concern. As we go into the fall, the weather gets cooler and drier, the virus transmits more easily. That's a concern. And I just got to say as well, you know, just based on what Caitlin was talking about, and I've talked to Dr. Walensky as well about the masks, it's very interesting to me at this point to say, are we going to get ahead of this or not? Have we learned lessons from just last year? Or are we going to be late on this again? I mean, this is really concerning. And frankly, if this mask issue wasn't so politicized, I think the answer would be very clear. That indoors, especially when you're, even if you're vaccinated, if you're around a lot of unvaccinated people and you're in an area where the viral transmission is high, you should probably put a mask on. I'm not sure why this is still so challenging a year and a half into this pandemic.
Obviously, Sanjay, there is concern that if that message is sent to a lot of people, that some people are going to interpret it as, well, if I still have to wear a mask and I'm vaccinated, what's the point of being vaccinated?
Well, I hear that, and I also realize that it might be, from a psyche standpoint, hard to absorb for the country. But people need to understand that that does not mean the vaccines aren't effective. Now, the vaccines are remarkably effective, but you know, you got to think about this not as a binary, like either I'm totally protected or I'm not. I mean, the vaccines may take what was otherwise be a critical illness where you end up in the hospital, in an ICU, and turn that into a mild illness, something that doesn't take you to the hospital. But even that is something you don't want. I mean, you don't want to have a fever of 103 and sick for 2 weeks, even if it doesn't take you to the hospital. There are people who get vaccinated that may still develop symptoms. That's the thing you've got to remember here. If you're around all vaccinated people all the time, that's great. Unfortunately, in the United States, we haven't gotten to that point. 50%, not even, of the country is vaccinated. So when you go out and about, you're likely going to be showered with viral particles. Your vaccinated body is going to do a much better job of protecting yourself, but it's not perfect. I mean, nothing is. And the idea of just slipping on 2 ear loops and protecting yourself, like we've been, again, talking about for a year and a half, it confounds me that we're still having this conversation. And we're finding all these loopholes and excuses not to do what we should obviously be doing.
Dr. Nguyen, to me, one of the arguments about I respond to, maybe it's because I'm a new parent, of wearing a mask even though I've been vaccinated, is the idea that we still don't know, if you have been vaccinated, how much you can transmit a virus to your child. So in your home, your kid, and we still have this idea that kids don't, you know, brush this off, that it doesn't affect kids, although we've now seen cases with Delta where kids have been hospitalized. So to you, what is the argument for wearing a mask if you've been vaccinated?
Well, the biggest argument that I can see is that we just don't know at this point about the Delta variant. And if we don't know key questions, we should be using an abundance of caution. The CDC is still operating in the past. The data that they are basing their advice on, saying that if you're vaccinated, you're protected, that was pre-Delta. We actually don't know the data about if you're fully vaccinated, but you contract the Delta variant. Are you able to transmit it to others, including parents to unvaccinated children? If we don't know what that risk is, then how are parents or anyone supposed to make a decision for themselves or their families? It makes a big difference if that risk is 1 in 100 versus 1 in 2. I mean, we literally don't know because the CDC is not collecting those data. It's been said that the CDC is a great institution in peacetime, but it's slow, and we're now in the middle of a war, and we just can't wait. And I'll just say one more thing about the Biden administration's message that is really off. They keep saying, if you're vaccinated, you're protected, implying that it only matters to you if you're vaccinated. It doesn't matter if other people around you are vaccinated or not. But that's just not true. As Sanjay was saying, if there's all kinds of virus around you, if you're in a community with a lot of virus, then because these vaccines are not 100%, it is going to impact you. So, I mean, as to whether this will undermine confidence in the vaccines, think about this like a seatbelt. We wear seatbelts. We don't expect that they'll save our life every single time. If there are a ton of people around us driving recklessly, we might need more than a seatbelt. But that doesn't mean saying that doesn't mean it's undermining confidence in seatbelts. It's just saying that the choices that other people are making influence us too.
Dr. Wan, Sanjay Gupta, appreciate it. Thank you.
If you're fully vaccinated, you have an extraordinarily small chance of being hospitalized or dying from COVID. We're talking about more than 99.999% of fully vaccinated Americans surviving thanks to the vaccine. Let's bring in our numbers whiz, Harry Enton. Harry, first, could you translate those odds for us? It is more than 99.999%. If you're vaccinated, those are your chances of surviving any breakthrough infection.
Yeah, I mean, look, we've had over 160 million Americans fully vaccinated. Of those, just north of 1,000 folks that died. It's so small. And you know, what I'm interested in is comparing the fully vaccinated to those who are unvaccinated. And what we know is at this particular point, if you are unvaccinated, your chance of dying is 25 times higher than if you're vaccinated. So if you have the opportunity right now to go get a vaccine and you haven't gotten one yet, the numbers paint a clear picture. You should do so.
Right. I mean, that data, those numbers, that's so concrete there. What do you know about recent polling? What is it telling us in terms of who's most concerned about the Delta variant?
You know, it should be the unvaccinated, but the polling data suggests it's in fact the exact opposite of that. There was an Axios Ipsos poll that was done towards the end of last month, and what did it show? Extremely or very concerned about the Delta variant. Among vaccinated adults, it was 54%. Among unvaccinated adults, it was just 25%. And this might be part of the reason why these unvaccinated folks aren't getting vaccinated, is because they're not afraid of getting the coronavirus. But the numbers we show, they should be afraid. They should be afraid, and they should be going out and getting vaccinated.
Right. I mean, if you're unvaccinated with this Delta variant doing what it's doing, you are at very high risk of getting sick and contracting that virus. What about masking? Are we seeing a similar split there?
That's exactly right. You know, if you're not going to get vaccinated, then you should at least be wearing a mask, right? But what does the data show us? The data shows us that the unvaccinated folks never wearing a mask when leaving the home. 35% of unvaccinated adults are never wearing a mask when leaving the home. My goodness gracious, what are they doing? That is significantly higher than the percentage of vaccinated adults who are never wearing a mask when leaving the home. So to me, this is all nutter butter. It makes no sense. These unvaccinated people, first off, they should get vaccinated. And if they're not going to get vaccinated, they should at least be wearing a mask. And 1/3 of them say they're never wearing a mask when leaving the house. It's mind-boggling. It's crazy. I don't get it, but the numbers are the numbers.
All right. Well, thanks for walking us through them. They're very persuasive. Harry Enton, thanks so much.
Thank you.
And joining me now to discuss is Dr. Anand Swaminathan, an emergency medicine physician in New Jersey. Dr. Swaminathan, great to see you. 99.999% of people who experience a breakthrough case do not die. How do you feel about those odds?
I feel pretty good about it as someone who is vaccinated and who lives in a state where vaccine rates are really high. That makes me feel good, not just for myself, but for my community, for my kids who are going to be going back to school, and for the patients that I take care of. And I think that's reflected in what I'm seeing at work. What we're seeing is that there are people who have COVID symptoms, but very few of them are very sick. And a lot of that is because of how well we've done with vaccination in our state and in the states around us. But, you know, one of the things that comes up over and over again that we have to really be careful about is that, yes, the vaccine, highly protective for me, highly protective for those who are vaccinated, but it's not just a personal choice to get vaccinated or not. Because of how it affects everybody else around you, we're going to see spikes with kids. We're going to see going back to school that schools are going to get closed down again because there are going to be outbreaks. And this is the thing that maybe people aren't really as focused on as they should be. It's not just about protecting yourself. It's about protecting everyone around you, including those who can't be vaccinated or have immune compromise, and the vaccine doesn't work as well for them.
Right. And so many of the people who can't be vaccinated are 12 and under. These are our children, right? I mean, those are the kids and the people that are some of the most at risk because they can't be vaccinated. Experts are warning that cases and deaths will continue to increase over the coming months in light of the fact that about half the country remains unvaccinated. Here's what Dr. Fauci said about it this morning. We'll listen.
I don't think we're going to see lockdowns. I think we have enough of the percentage of people in the country, not enough to crush the outbreak, but I believe enough to not allow us to get into the situation we were in last winter. But things are going to get worse.
Dr. Swaminathan, how worried are you about where this is headed, what the trend lines look like?
Well, I think as a country, we're not going to see the same spike that we saw in the winter, or if we go back to March, the same spike that we had in our area. The problem is that regionally, we're going to see huge spikes. And talking to my colleagues in other states, they're already feeling it. Their emergency departments are full, the hospitals are full, there are no ICU beds. I've spoken with a couple of folks who deal with transferring patients when there are no ICU beds, and they're like, there's no ICU beds in my county, there's almost none in the state, and that's not just for adults. There's no pediatric ICU beds either. So that means that if a kid gets really sick, there's nowhere to go. And it's not just about COVID. If you get in a car accident and you're really sick, there's no place to go. And so those states, Arkansas, Louisiana, Texas, Florida, they're going to see huge spikes in cases. They're going to see a lack of ICU beds, and they're going to see spiking deaths because of the lack of resources. It really is a very complicated layout when you have so many cases coming up. It's not just about how lethal COVID is. It's about how lethal it is in the setting of reduced resources, which is what we're going to be seeing.
Right, the strain on the healthcare system generally. South Carolina's Republican Governor Henry McMaster is accusing U.S. health experts of, quote, exaggeration and engaging in frightful hyperbole in regards to the tone being taken to explain how serious the Delta variant is, how different it is. We should note Governor McMaster is encouraging people to get vaccinated. Do you think is anything being blown out of proportion?
I'm very offended by the comment as a doctor and for my colleagues who are doing this work as well. And this is why we don't take our medical advice and our scientific advice from politicians. That's not how this works. I think it's great that he's pushing for vaccines, but how confusing of a message is that to his constituents? Get vaccinated, but it's not as bad as everyone's telling you it is. And this disinformation is killing people. Absolutely, it has been the whole way through. And it's getting worse because it's hard for people to really tease apart the information that's coming at them and know what to do with it. This Delta variant is terrible. It's spreading faster. There are hints that it could be more lethal. And even if, again, the virus itself isn't more lethal in this variant, with our waning resources because of how many cases we have, it will end up being more lethal. And look what we see in India, what we saw in the United Kingdom. This is not a good thing. And listening to a politician talk about science, it's absolutely embarrassing for him to be really putting these ideas out there that are, frankly, just they're lies.
And you know, there is so much that changes, and I know people are tired of having to follow every tiny change, but this Delta variant is different, and as you just explained, why it's so different, why it's so serious. Dr. Francis Collins, the director of the National Institute of Health, expressed support for having businesses require vaccine credentials if that helps encourage people get vaccinated. You've said you think it's time for the U.S. to start moving toward vaccine mandates. Have we gotten to the point where that's the only tool left in the box? Are there other things that can be done?
I'm sure there are other tools that we can look to as well, but I think the time for vaccine mandates, for vaccine passports is here. If not, it's already passed. We should have started this a while ago. I think we absolutely do need to see this. And I think it's great that individual businesses, private businesses are requiring their employees to do this or to get tested very frequently. My hospital just recently said that they're going to require everybody who works there to be vaccinated. I think that is a huge positive step. But I think we need something that is a little bit more across the board to really require this. And, you know, the time for the carrots, the rewards for getting vaccinated, it's still there. Anything that we can do to get people vaccinated, to convince them to do so is great. But it's time for us to also add some of the other ways that we can encourage people by taking things away. If you're not vaccinated, you can't do X, Y, and Z. Yes, you've made a personal decision, but you're also making a personal decision to put others at risk, others at harm, and this is how you're going to be penalized. Now, we might even see insurance companies saying that if you're choosing not to be vaccinated, you're going to pay a higher premium, similar to what they see for people who smoke. And that's going to be another stick to try to encourage people that this is the right thing to do. Get vaccinated. And I can't really say it enough times. If you're out there and you have access, if you can get vaccinated, go get it done today.
You know, I've been trying to write a vaccination theme song for a while, you know, get people to actually get the shot. But not many words rhyme with vaccinate. Maybe perpetuate? Perpetuate? The struggle to vaccinate enough Americans against the coronavirus in order to achieve herd immunity has produced frustration, anger, and a whole lot of people doing things directly against their best interests when it comes to their health. Maybe the most upside down, almost hurt my neck, bit of reality that's emerged from the politicization of what should be a public health issue, thanks Donald Trump, is this. The people at the most risk of being infected with the Delta variant of the virus are the least concerned about getting it. A July CBS News YouGov poll paints a stark picture of this remarkable disconnect. Asked whether they were concerned about the Delta variant, the dominant strain of COVID-19 in the United States, and the one that has led to a major surge in cases, almost 3 in 4 vaccinated people, 72%, said they were worried about it. Less than half, 48% of unvaccinated people said the same, which is, and this is a technical science term, bonkers, because, well, science. Quote, we're seeing 99.5% of deaths right now from COVID-19 in our country are happening among the unvaccinated. U.S. Surgeon General Dr. Vivek Murthy told CNN's Dana Bash on State of the Union in mid-July. And in case you missed it, 99.5% of people who are dying from the coronavirus right now are not vaccinated, which means, because, again, math, that less than 1% of all COVID-19 deaths right now are among vaccinated people. And that's not a fluke or an anomaly either. In June, 99.2% of the people who died from COVID-19 were unvaccinated, according to none other than Dr. Anthony Fauci. 99.2%! To understand just how much of the politics of the virus has infected our country, let's take those numbers out of the coronavirus context. Let's just say there was a pill developed and approved by the Food and Drug Administration, which guaranteed that you would live 5 healthy years longer than you would without taking said pill. You would take the pill 100% of the time, right? Because who wouldn't want to spend more time with family and friends, right? Right. And yet, in the case of the COVID-19 vaccine, which has success rates of upwards of at least 86% in terms of preventing serious infection and hospitalization, not to mention death, we are still having this dumb debate in some parts of America as to whether or not people should get the shot. It's not even a theoretical debate. States with the lowest number of their citizens vaccinated are having some of the largest outbreaks from the Delta variant. In Arkansas, just 36% of the population is vaccinated and cases are soaring. State of Missouri, with just 41% of its population vaccinated. And Louisiana, where just 37% of people are vaccinated. Get the trend? Now, why is this? Well, it's because Donald Trump turned COVID-19 from a public health issue into a political one to try to win re-election. Remember these two maps? The first is the one you just saw on vaccination rates by state. And then there's this one, which is the 2020 election results. Notice anything? Yeah, the states Trump won are consistently less vaccinated than the ones Joe Biden won, which should not be the case. Because you could be the most conservative Republican or the most liberal Democrat, and these two facts are still true. Fact 1. The Delta variant is on the march throughout the United States, targeting primarily the unvaccinated. Fact 2. The vaccine lessens the symptoms if you do happen to get the Delta variant and drastically reduces your chances of dying from the virus. The idea that less than half of unvaccinated Americans say they are concerned about the virus seeks to ignore those two indisputable facts, not to mention science, also epidemiology. As Fauci said in late July, quote, 99.5% of the deaths in the United States are among unvaccinated people, and 0.5% are among vaccinated people. Boy, if there ever was a statistic that would stimulate someone to get vaccinated, I think this one is it, end quote. Yeah, good call, Fauci. Put simply, unvaccinated people are, whether they're worried about it or not, at significantly greater risk from the Delta variant. If or when they get the virus, whether they were worried about it won't play any factor at all in how and if they recover. And the virus won't care one bit whether they are a Republican or a Democrat, or even who they voted for in the 2020 election. And that is the point. We make new point episodes every Tuesday and Thursday. I hope you check them all out.